How is a cold knife cone biopsy performed for cervical screening? Imagine a procedure that helps doctors get a closer look at abnormal tissue in the cervix to catch problems early. That's what a cold knife cone biopsy is all about. It's a surgical method used to remove a cone-shaped piece of tissue from the cervix, mainly to diagnose or treat precancerous changes or early cervical cancer. The goal is to take out the part of the cervix where abnormal cells tend to develop, especially in the transformation zone. The procedure usually happens in a hospital setting. Before it begins, the patient goes through a thorough evaluation. This includes reviewing medical history, doing a physical exam, and sometimes running lab tests. If the patient might be pregnant, they should tell their doctor. It's also common to stop certain medications beforehand and avoid smoking to help with healing afterward. Once everything is prepared, anesthesia is given. The type of anesthesia can vary. Some patients receive general anesthesia, which means they are completely asleep. Others might get regional anesthesia, like a spinal or epidural block, which numbs the lower half of the body. This way, the patient feels no pain during the procedure. The surgeon then carefully uses a surgical scalpel to cut out a cone-shaped piece of tissue from the cervix. This tissue includes the outer part of the cervix, the inner canal, and the transformation zone. The size of the cone depends on how much abnormal tissue needs to be removed. The goal is to get a clear sample that shows whether abnormal or cancerous cells are present and whether the edges of the tissue are free of disease. After removal, the tissue is sent to a lab for detailed microscopic examination. Pathologists look for signs of precancer or cancer and check if the edges of the tissue are clear of abnormal cells. This helps determine if the abnormality has been fully removed or if further treatment is needed. Recovery from a cold knife cone biopsy takes some time. The patient is monitored for immediate issues like bleeding or infection. Because it involves removing a larger amount of tissue compared to less invasive procedures, recovery might take longer. There is also a small risk of complications such as bleeding, infection, or cervical narrowing, which could affect future pregnancies. This procedure is especially useful when less invasive tests are inconclusive or when severe cervical dysplasia or early cancer is suspected. It plays a vital role in early detection and management of cervical health issues. It's important for patients to discuss the benefits and risks with their healthcare provider and to follow up with recommended cervical screenings afterward. Always remember, personalized medical advice from a qualified professional is essential for the best outcomes.